Interstitial cystitis is a disease of the bladder with frequency, urgency, possibly urgent continence, and pelvic pain. It can also be called bladder pain syndrome. The symptoms can come and go and get worse over time. I've been doing national research in it for over 20 years, probably closer to 25 years. I'm currently doing 2 research projects, and I'm the lead investigator for the country at multiple sites in the country for a bladder installation with medicine that can help the symptoms of specifically pain and also urgency associated with interstitial cystitis. So we're trying to get this bladder installation FDA approved. Interstitial cystitis symptoms can range from mild to severe, and again, they can come and go and get worse over time. There's a lot of different treatments. Do a special interstitial cystitis diet, go on a strict diet for 3 weeks and reintroduce one food at a time. The IC diet is no alcohol, citrus, tomato-based products, chocolate, coffee or tea has to be decaffeinated and acid-free, no sodas or sparkling drinks of any type, no tap water, because we don't know how much potassium is in the tap water. No Dasani or smart waters because they add potassium. So again, the strict diet for 3 weeks, and reintroduce one food at a time and wait 2 days. It may not bother you that day, it may bother you the next day. There's only one oral medication FDA approved for the treatment of interstitial cystitis called Elmiron. It's 1 tablet 3 times a day on an empty stomach. That can take several months to really kick in. Only 6% of Elmiron gets into the bladder. So sometimes off-label we'll do a higher dose. And then once we get control of symptoms, then we'll lower the dose. Other treatments is the bladder installation that I'm doing research on. It's local anesthesia, with lidocaine, heparin, which helps heal the bladder lining, and bicarbonate, which makes acidic urine neutral pH, and this combination is soothing to the bladder. The defect for interstitial cystitis is the inner lining of the bladder called the glycosaminoglycan layer. And microscopically, that becomes leaky specifically to potassium. And potassium irritates the nerves, and that's what causes muscle contraction. So that can lead to the frequency, urgency, and urgent continence. The potassium also irritates the nerves, makes them more sensitive. So think of it as a sunburn. This doesn't hurt. If you have a sunburn, just tapping hurts a lot. So it makes the nerves more sensitive, and that can cause not just pain to the bladder, but the whole lower pelvic area or lower back, and lead to not only chronic pelvic pain, but women, painful intercourse and pain after intercourse. And in men, it can cause painful ejaculation. Other treatments we can do is there's a lot of frequency urgency. We can give overactive bladder medication to try and calm that down until we heal up the bladder better. For severe pain, we can give amitriptyline. It's an antidepressant. We're not going for that, but it decreases the nerve transmission of pain. So I recommend long-term multimodality therapy. So we may keep adding more layers of therapy until a person gets better. And once we get better, we slowly, like an onion, peel off a layer of therapy at a time until we get the lowest dose of stable symptoms. A lot of these patients, we can't get to maybe a normal bladder, but instead of periodic severe symptoms, we just hope for a little speed bump now and then along the way.